Welcome to Consulting Check and welcome to the part 2 of committees. So let's get started. So in this second part, we'll be talking about Mortality Morbidity Committee, then Blood Transfusion Committee, then Clinical Audit Committee, then Code Blue Committee, then Condemnation Committee, then Drugs and Therapeutics Committee, and then Risk Management Committee. So Mortality and Morbidity Committee. Here you are supposed to do RCA kappa of death cases. So in this meeting, which is held every month, you have to discuss on the death cases. Okay. So why that death had happened. So whether there are any opportunities for improvement. Was there anything that we could have done to save the patient? So in terms of manpower, if we could have taken a more skilled manpower, or certain training was required, or certain equipment was not there, which might have helped the hospital to save the patient, or was there any infrastructural gap? Certain infrastructure improvement could have saved, or certain processes could have saved the person. So these things are discussed, and we also discuss about the standardized mortality ratio. So this is done in ICU, where you do Apache score, and you score the patients who are coming to the ICU, and you get a number for predicted death. So Apache score is something where many vitals of the patients are taken and certain score is given. So if they have low score Apache, then the likelihood of survival increases. If they have higher Apache score, that means the patient is very critical, and the chances of survival is very less. So the number of predicted death and the actual death needs to be seen. So if the number of actual death is more than the predicted death, then something is wrong, definitely. Okay, and you also need to see which patient had more Apache score, and the patient was saved. So what we did. So the positive things also needs to be discussed, and if the patient's Apache score was less, but still the patient could not make it, those cases needs to be discussed. Okay. Now the Blood Transfusion Committee. So you need to sit for at least every 3 months. So here you review the transfusion cases. So how many transfusions were done? Those things needs to be discussed, and out of those, if there were any complications, if there were transfusion reactions, so the root cause analysis, corrective action, preventive action needs to be done. And those transfusion reactions needs to be reported to Hematovigilance Program of India. And they also need to, if you have a blood bank, then the wastage review needs to be done. So how many blood or blood products were expired, were issued, but it was not used, and then it expired. Those data needs to be seen, so that the blood units and the blood product units needs to be optimized, and to take the corrective action, preventive action, so that such kind of losses can be minimized. Okay. Then you need to review the quality monitoring of blood centers. So this happens when you have a blood bank where you are doing external and internal quality control. Your external quality control BE/QAS scores needs to be good, so that it is ensuring that your quality is maintained in comparison to all the other blood centers who had enrolled in Vikas. And internal quality control, it's not like how we do IQCs in the medical labs, but it is according to the number of blood units processed. It is much lesser in case of blood bank. Okay. Clinical Audit Committee. In Clinical Audit Committee, they manage and ensure that the clinical departments, they are conducting the clinical audits. Okay. So they first choose the medical scope. So basically they choose which scope of service they should have the clinical audit first, and then they also choose the topic. So how do you do it is, you have several scope of services in your hospital. You prioritize it as the hospital, the services which has large number of patients. Okay, IP patients, OP patients. So you take that first, and then and in each of these scope of services, you try to understand which kind of diseases are more prevalent. Okay, so what kind of patients they are coming. So accordingly, you can choose the topic for clinical audit. Then the committee needs to ensure that all medical specialties have clinical audit once in 2 years. As per NABH 5th edition, it was once in 1 year. As per 6th edition, it has become once in 2 years. Okay, so they can prepare a calendar, plan, and then accordingly go ahead with their plans. Okay. The Clinical Audit Committee, they have to work alongside Mortality and Morbidity Committee. Why? Because the death cases which are discussed in Mortality Morbidity Committee, that needs to be taken, and they need to see which specialty those cases are happening, and accordingly decide on the topics for clinical audit. Okay. And another very important thing is, they have to try to improve the clinical outcomes. So by clinical audit, when they do the whole process, they take a topic, they take data, whether it is prospective or retrospective, and then take the corrective action, and accordingly they see the improvements. So the main thing about the Clinical Audit Committee is to improve the clinical outcomes. Okay. Now the Code Blue Committee. In Code Blue Committee, they need to discuss about the Code Blue cases. So the Code Blue cases which happens every month, they need to discuss that. This can be done quarterly. Okay. So whether it is actual Code Blue or mock drills, Code Blue mock drills, they need to review each step of those Code Blue cases or mock drills. They have to ensure that all hospital staff are aware and ever ready for Code Blue. Okay. So every time they meet, they also try to understand from the HR, the people who are doing the BLS training, whether they have covered all staff or not. And to do a quality check, they can do surprise code blue mock drills anytime. They have to conduct mock drills so that the staff, they are well aware, they have practice, and in case of the real scenarios, they can act on time and with high quality code BLS is delivered. Okay, and then they need to do RCA Kappa for any discrepancies that they find from the mock drills or from the real code blues. If in a 100, 150, 200 bedded hospital, this will happen anytime. This can happen anytime. I've seen like 2-3 real code blue cases happens every month in a hospital. And if your hospital is small and you're not getting that kind of cases, then you have to do mock drills. For beginning, if your team is new and all, it is recommended that you do code blue training, code blue mock drills every month. Okay, just one case in your half an hour time, you can see your effectiveness of your staff, how good they are handling those code blue. Okay. Condemnation committee can meet quarterly for their discussions. So first thing, they have to make sure that the store, biomedical engineer, maintenance and finance, they all work in sync for asset management. They need to ensure that the upkeeping of vital and essential equipment is being done. So how they ensure that upkeeping of vital and essential equipment is there? So the biomedical engineer, the maintenance person, they can always tell in the condemnation committee meeting that these equipments are nearing their service life, and you have to renew it. You have to get a new one so that the patient's care is not compromised in any way. They also need to decide. So whenever a department says or forwards that we have to condemn this equipment because this equipment is not working, and the biomedical engineer, the team of biomedical engineers, they make a call whether to repair the equipment so that it can be used for another 6 months, 1 year or 2 years, or condemn the equipment because nothing can be done about that equipment. Or third thing, you know that the equipment cannot be repaired, but the spare parts of those equipments can be used in other equipment whenever there is, say for example in a monitor, a part of the monitor gets you have to replace it, so that part of the monitor can be taken out from the condemned from the equipment which is unrepairable. Okay, but you still keep the equipment, and once everything is taken out, squeezed out from that equipment, then you tell it in the condemnation committee that this has to be condemned and it needs to be sold off. Okay, then they need to ensure smooth condemnation of assets, helping finance department in loop. Okay, so where to sell it off, what would be the cost, all that the finance department needs to be in loop. Okay. Drugs and Therapeutics Committee. So here there's a lot of work here. They need to meet at least quarterly. So they ensure the implementation of formulary. So formulary one, once it is made, they have to ensure that it is being practiced, it is being followed in the hospital. Okay, so for that they do prescription audit. From there they see whether the formulary is being followed by doctors or not. Okay, then any decisions on additions and removal of medicines. So they need to use a form for addition or removal request of medicines, which is being filled by the consultant and being given to the Drugs and Therapeutics Committee. So this thing can happen anytime. So at that time they can have a short meeting where they discuss about whether to take this thing or not, take the medicines or not. Okay, then in unison they take a decision and then add or they reject adding the new medicine in the formulary. Okay, then prevention of medication error. So there are several practices which are being done. So any medication error which are reported, that needs to be discussed in the Drugs and Therapeutics Committee. And also ensuring that the training of different kinds of medication error, how to do the reporting of medication error, all those things are in place. They have to ensure that. Then the adverse drug reaction. So whenever there is an adverse drug reaction reported, its RCA kappa needs to be done, and they ensure that these adverse drug reactions are reported. Okay, then they also ensure that the staff vaccination coverage is there. Then work alongside Infection Control Committee for antibiotic stewardship. So antibiotic stewardship program. So the usage of antibiotics is seen by the infection control team, and whether those drugs are being prescribed. So there are three kind of line of drugs as per WHO, which is called aware. So access, number one, the first line. Second line, watch, and reserve, reserve. That is the third line. So those things needs to be discussed in the Drugs and Therapeutics Committee as well. Okay, so this is like a intersection of Drugs and Therapeutics Committee and the Infection Control Committee. Then they need to discuss on the prescription audit findings. So in the prescription audit findings, the findings can be like whether the proper details of the prescription are there or not, the food-drug interaction and the drug-drug interaction, whether those things are being taken care in the prescription or not. That also needs to be audited in the prescription audit. Okay. Risk Management Committee. So they sit for the meeting for every quarter, so every 3 months. So what they do, they discuss about the findings of patient safety audit. So patient safety audit, as you know, it is done by both clinical and non-clinical personnel. That is as per the International Patient Safety Goal. Okay, so the findings, they have to do RCA kappa about that. Then the findings, they have to discuss on the incident reports and then resolve it. So out of those many incident reports which are being reported every month, the quality team, they funnel it out. They take certain incident reports and then discuss about those in the Risk Management Committee. They also discuss about the HERA findings, HIRA is hazard identification and risk assessment, which is done across most of the departments. So the RCA Kappa, any changes in the HIRA assessment, those things, or any discrepancies in the HIRA assessment, those things needs to be discussed in the risk management committee. Then they have to ensure fire safety. Ensuring fire safety as in whether all the people they are trained as per the whether they are ready for code red. They need to discuss about facility round audit findings. So there is a facility round audit checklist which is done by a maintenance person. They go round the hospital and they observe things related to maintenance, and whatever discrepancies they find out, they have to take corrective action, preventive action on those, and they need to discuss that in the risk management committee meeting. Then mock drills. So it's not just the code red mock drill that they need to see. They have to see code pink, code yellow and code violet as well. So these are all related to risks. Okay, so they have to ensure that everyone is prepared for this, and any discrepancies found in the mock drills of these trainings needs to be corrected by the risk management committee. Okay, so thank you for watching this video till the end. I hope it was informative, and please comment your thoughts, like this video, subscribe to the channel, and please share this with your team so that we spread the knowledge. So see you soon. Thank you so much.